All right, what is up, PT on Ice crew? Got Instagram over here. We've got YouTube over here. If anyone's watching this on YouTube, just let me know in the chat bar if you can hear me clearly or not. Pumped to be here on Clinical Tuesday. I'm Dr. Mark Gallant, lead faculty for the Ice Extremity Division, alongside Lindsay Huey and Eric Chacones. As far as announcements, big one, we've got the ice sampler coming up in 10 or 11 days. We all can't be more pumped to hang with all of you out in Hendersonville, Tennessee. If you weren't able to sign up for this year's ice sampler, definitely be on the lookout for next year's, because these things keep getting better and better. I mean, the list of presenters on this year's list is just out of control. As far as other ice courses, I'm not going to go through each individual course, but definitely hop onto the website, because all ice divisions are in full steam ahead right now. So every course has multiple offerings coming up somewhere throughout the country, and all of our online courses are in full swing. So if you haven't already, definitely jump on board for that, because a lot of these courses are selling out now. So if your goal is to get to a couple of these courses in 2022, definitely jump on as soon as possible. What I'd like to talk to you all about today is elbow pain from kind of a 30,000 foot view. I'm going to come on here in another few weeks and give a little more specifics about how we treat it out, but today I want to give the big picture. And I think the first thing we need to admit is, for most of us in clinic, when we're talking about elbow pain, what we're really talking about is elbow tendinopathy. Now, for those of you who treat a lot of post-op, who treat a lot of trauma or acute trauma, certainly elbow stiffness is going to be something that you see frequently in clinic. But for a majority of us, it's going to be those elbow tendinopathies. Also, if you're treating a lot of overhead athletes, a lot of throwers, you may see a decent amount of UCL injuries or post-Tommy John surgeries. But again, these are going to be specialized populations. For the majority of us, we're really treating lateral and medial elbow tendinopathy, with lateral elbow tendinopathy being the most prevalent in the general population. And then in the fitness athlete space, maybe medial elbow tendinopathy creeping up a little bit more. The first thing we have to admit when treating elbow tendinopathy is that the research isn't super robust, right? We've got a lot of studies out there, but they're typically small sample size. They're not the best quality. It's not an area where the research can really definitively guide us at this point. And that makes a lot of sense, and it's okay, because it's not an area that's typically as debilitating to society, right? When we have low back pain, there's like 149 million days of work missed per year because of low back pain, and somewhere between 100 and 200 billion dollars of cost that low back pain causes to society overall. So it makes sense that the research and all the money funding research is going to funnel into things like low back pain and headaches that create a greater societal economic burden. There's not a lot of folks who are missing 100 days of work per year because their elbow is a little bit sore. But that doesn't mean it doesn't matter, right? It matters to us, the people that are treating these patients, and it definitely matters to the person who's having symptoms when they're opening doors, when they're picking stuff off the ground. So we need to know how to treat it, despite the fact that there's not a lot of high-level research currently. We do have a systematic review. Peter Hogelveit out of the Netherlands, British Journal of Sports Medicine, who showed basically what I just told you all, is that there isn't a lot of super robust research about how to move forward treating medial and lateral elbow tendinopathies. But what Peter Hogelveit does state in that article is it seems like all of the research is pointing to two things. The primary thing being resistance and loaded exercise, which makes a lot of sense, because that's what we're seeing in all of the lower extremity tendinopathies as far as the primary way to treat them out. And the second thing Peter Hogelveit says is using manual therapy as an adjunct to your resistance and your loaded exercise. Well, that really fits the bias of us here at ICE quite well, being fitness forward, manual therapy skills, psychologically informed practitioners. It's really nice to see that, despite a lack of research, that the research we do have is pointing towards fitness forward should be your primary way you're treating these folks out, and then manual therapy to help relieve the pain. Well, let's take a look at what this looks like overall. So from that manual therapy perspective, what we're really going to be using our manual therapy for is to decrease the pain overall, to bring some pain analgesia so that we can load these tissues more effectively. Well, there's really three areas that are our primary ways of treating this with manual therapy. The first, and one that's been around seemingly the longest, is mobilization manipulation. And we've got a bunch of smaller studies from folks like Leanne Bissett, Brooke Coombs, Bill Vincenzino, all of those folks out of Australia have really showed us that using joint manipulation at the humeral ulnar and humeral radial joint, mobilization of those joints can really decrease the pain to enough level that you can load these tissues up effectively. Again, these studies are smaller sample size, but they're the best we have. And again, those folks out of Australia have shown that mobilization manipulation is a great adjunct treatment to your loaded exercise. Myofascial decompression is another one that's gaining a lot of popularity. Again, not a lot of robust research around myofascial decompression, but certainly we're getting a lot of anecdotal evidence that throwing some cups around the lateral triceps, some of the wrist extensors on that lateral sides, medial epicondyle soft tissues on the medial side, has some great pain reducing effects that's going to allow you to load those tissues more effectively. If you haven't checked out anything with myofascial decompression, definitely check out cuptherapy.com. Shout out to Chris DiPatro. That's a great resource if you're trying to learn in that space. And then finally, dry needling, which has become wildly popular in the past 2 decades. And we are starting to get some more robust research around dry needling in the elbow space. We've got a systematic review meta-analysis by Marcos Navarro Santana that came out last year showing that indeed throwing some darts into those elbows can decrease pain to a significant level and improve function so that you can get those patients loaded. So again, using our manual therapy as an adjunct to our loading, using joint manipulation, mobilization, myofascial decompression, dry needling is our primary sources there. Well, then we're going to move on to the main course, the loading. So ever since Alfredson came out with his Alfredson protocol in the late 90s for the Achilles tendinopathy, people just ran wild with that. They jumped all over it, extrapolated it to literally every other tendon in the body, that doing a lot of eccentrics, heavy eccentrics consistently really helps move these tendon issues forward. And there is a lot of benefit to using eccentrics when progressing these tendinopathy patients along, even in the elbow. So one thing that's nice about using using eccentrics for tendinopathy is that we're going to train 3 things specifically with those eccentrics. One, that eccentric motion really trains the brakes. So slowing the joint down, slowing things down, like saying you're throwing a baseball or trying to grab something out of thin air, using that eccentric motion can help train that slowing down motion, which is really nice. Eccentrics also train compression really well, which compression is something that can be a little bit irritating with tendinopathies. So it's really important that we train that component out. And that eccentric motion at a full range of motion tends to be the spot where the tendons and the soft tissues get compressed across the joints and bones. So definitely want to include that as part of your overall treatment package. And then potentially the most important thing is changing the length tension relationship of the muscle and tendon. So we know that muscles and tendons tend to be their strongest at that mid range of motion point when we're picking things up or using our limbs. We want to increase that so that the length tension relationship improves through a full range of motion. And eccentrics are a wonderful way to do that so that we can tolerate loads for the elbow specifically at greater ranges of elbow extension. The eccentrics may be our best tool to train that aspect out. But eccentrics aren't the only type of load you want to use. At ICE, we're always saying and not or. You probably to exhaustion for many of you, but we're going to keep saying it. There are other types of tissue contractions that are going to be important to train out for most of our tendinopathy patients. Isometrics, concentrics, they all have their place because the tissues have to handle each of those type of loads throughout the day. So it would really behoove us to train out both isometrics, concentrics, eccentrics, because these tissues are all going to have to handle that load. Again, I'm going to take you through in a few weeks from now, specifically how we like to dose out those isometrics, eccentrics, and concentrics. But for now, just know that you're going to want to use all of those different types of contractions. The other cool thing is that we're getting some research out that the nervous system and our hormonal system respond a little bit differently to each type of contraction. So as far as getting a robust treatment paradigm, getting each of those isometrics, concentrics, eccentrics to get not only the local tissue response, but to get a more robust nervous system response and a hormonal response to provide a well-rounded treatment is going to be really important. On top of that, you know, at ICE, we love the big compound movements, the overhead press, the deadlift, the squat, those sort of things. We need to find the functional problem that the patient's having. Are they having trouble reaching overhead? Are they having trouble picking stuff off the ground with that elbow tendinopathy? Well, then it's going to be really important for us to add things like rows, bent over rows, overhead press, push-ups, pull-ups, whatever the functional problem is. We want to get that overall robustness as well as the local tissue contraction. And then finally, speed. So in sports, the saying always goes that speed kills. Well, in tendinopathy, speed also kills. So these tendons have a hard time reacting to dynamic motions. So once you get the tendon so it can handle pure tensile load with your concentrics, your isometrics, your eccentrics, you're going to want to train out motions at more of a velocity. So when we throw something, oftentimes those joints are moving at 6,000 to 7,000 degrees per second. That's a lot different type of force for a tendon to handle. And that needs to be progressively trained the same way you would progressively load something like a bent over row, an overhead press, right? Starting out slow. Okay, can they handle 60 beats per minute on the metronome? Okay, now can they bounce the ball against the wall? Can they handle 90 beats per minute on the metronome, and progressing that way to make sure those tendons can handle speed overall? So again, we want to get every type of contraction to get a well-rounded program. So overall, when we're looking at these elbow tendinopathies, we want to use our manual therapy to decrease pain, whether that's dry needling, whether that's myofascial decompression, joint mobilization manipulation. Then we want to make sure that we're loading the tendon progressively. We're going to use isometrics, we're going to use concentrics, we're going to use eccentrics. They're all important. Then we're going to make sure we're going after the functional problem that the person's having. Using the big compound movements is our favorite way to do this. So are they having problems pressing overhead, push-ups, those sort of things, and then tackling speed? Can these tendons handle dynamic motion at high velocities? And that's really going to give you a well-rounded treatment paradigm. Again, I'm going to hop on here in a few weeks and give you more specifics on how we like to dose that out and progress that over a plan of care. Love to hear your thoughts in the chat bar. Hope you all have a wonderful Tuesday. Can't wait to see you all out on the road, and have a great rest of your week.